Simone's, right?
Yes.
Oh, I got the wrong sheet here. I got your CPE sheet. Okay, so whenever you're ready to start, that's fine. And I'm gonna give you time at the end to say, you know, it gets to be close to 30 minutes, I'm gonna say, okay, you know, what else did you think about?
Okay.
Each thing is just 1 point.
Alright.
Okay.
Ready? Okay, so I do hand hygiene before I go in and introduce myself. Hi, I'm Amanda Smoes. I'm going to be your student nurse, and today we're going to do your physical exam. Is that okay?
Yep.
Okay, perfect. Can you tell me what you had in the last 24 hours?
I had a bowl of cereal, coffee, and a pizza and a sandwich.
Okay, and can you tell me where you are?
Nursing building.
And can you tell me your name and date of birth, please?
January 7, 1996, Florida Park.
Okay. Patients oriented ×3. They are alert. Speech is non-pressured and fluent. They have a well open, friendly affect. They're well groomed, well nourished. Now I'm just going to take a look at your skin. Skin is intact, no lesions or rashes. It's dry and warm to the touch. I'm going to check your capillary refill. There's no clubbing of the nails. Capillary refill is brisk, and I'm going to check your turgor. Okay, turgor is also brisk. Hair is evenly distributed, dark brown, and non-brittle. Now I'm going to take a look at your head. Patient's head is normal cephalic. There's no lumps or deformities, and the facial features are aligned. Her eyes are aligned with her ears. Her facial expressions are symmetrical, and there's no skin is all intact there also. Now I'm going to palpate the head. Okay. Sutures are all fused together. There's no lumps or deformities in the head. Now I'm going to do the cotton wisp test. So just tell me now when you feel this.
No. 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 No.
Okay, very good. And can you raise your eyebrows for me? Okay, and can you frown? Can you smile? Okay, can you purse your lips and show your teeth? Okay, and can you close your eyes?
Don't ruin our makeup.
Good. Okay, and can you clench your teeth for me? Okay, and open. Okay, and move side to side. And close. Okay, TMJ is it has full range of motion and has no crepitus. And yeah, there's no crepitus. Okay, now I'm going to measure the JVD. And I'm going to lay her back at a 45 to 30 degree angle. JVD is less than 3 centimeters. And same for this side, is less than 3 centimeters. Okay, and now I'm going to have you sit back up for me. And I'm going to palpate your lymph nodes. Okay, there's no swelling of the lymph nodes and they're non-palpable. I'm going to palpate your trachea. Okay, trachea is midline. Carotid arteries are a 2+. And I'm going to palpate the thyroid. So can I have you swallow? Okay, good. Thyroid is non-palpable. There's no masses or deformities. Now I'm going to percuss your sinuses. Any tenderness?
No.
Okay, very good. And now I'm just going to listen for bruise. Okay, and no bruises are present. Now I'm going to examine your eyes. Eyelids close fully, skin on the eyelids are intact, eyebrows are symmetric and hair is evenly distributed, eyelashes are evenly distributed and outward. Her irises have a smooth round border and they're equal in size. Her pupils are also round and equal. The conjunctiva is pink and moist. The sclera is clear with no hemorrhaging or foreign bodies. Now I'm going to palpate the occipital bones and the lacrimal glands near to your ducts. Any tenderness?
No. 426739.
Okay, and the other eye?
426739.
Okay, perfect. Patient has 20/20 vision in both eyes. Now I'm going to do your pupillary light reflex. So just look straight ahead for me. Good. Okay, and now can you focus on something in the distance, please? And now focus on my pen. Good. Okay, pupils are pearl up. Now can you cover one of your eyes, please? Okay, and the other one? Good. Cover, uncover has no stigmas. Now I'm going to, can you cover one of your eyes? Okay, and tell me when you see my fingers.
Now. Now. Now.
Okay, and switch.
Now. Now. Now.
Okay, very good. Now the corneal light reflex is present in both eyes. And I'm going to do the ophthalmoscope exam. Okay. Okay. So just look straight ahead for me. Okay, red reflex is present. Optic disc is a creamy orange towards the bridge of the nose. The macula is a dark red towards the temple, and the vessels are a 2:3 ratio. And check the side. Okay, and the same is also true for this eye. Okay, and can you follow my finger for me? Okay, very good. EOM is intact with no lid lag. Now I'm going to examine your ears. Ears are even in skin tone, there's no drainage. I'm going to palpate. Is there any tenderness?
No.
Okay, no tenderness in the ears. Now I'm going to do the whisper test. Can you go like this to one of your ears? Okay. Basketball.
Basketball.
Water.
Water.
Chair.
Chair.
Very good. Okay, and the other ear.
Dog. Flower. Tree.
Very good. Okay, and now I'm going to do the ear exam. I'm sorry, ones.
Oh, we do this.
They don't like twists like they usually do.
Let's see. You won't take, I won't take all points for this, because these are, it depends on which one of these that you use.
Is it those over there?
What is this?
Okay, there's the one test.
I think it just has to slide in there just right.
Yeah, okay. So I pull up and back. Okay, ear canal is clear with no foreign bodies and no cerumen. The tympanic membrane is pearly gray, it's flat, intact, and the cone of light is present. Okay, and the same is also true for this ear. And now I'm going to look at your nose. Okay, can you look up for me? Okay, nose mucosa is pink and moist. There's no bleeding or polyps. The septum is intact, and there's no drainage, and it's clear. Now I'm going to test for your patency. Breathe in for me, and the other side. Okay, patency is bilateral, and the nose is proportional to the face. It's aligned, straight, and I'm going to palpate. Is there any tenderness?
No.
Okay, and the cartilage is midline. Now I'm going to take a look into your mouth. Can you open up and say ah for me?
Ah.
Okay, tonsils are 1+. The uvula rises midline and is, the uvula rises symmetrically and is midline. The tongue is also midline. Dentation is intact. Lips are intact. Gums have no bleeding and pain or tenderness?
No.
Okay. Okay, no masses or tenderness. Now I'm going to test for tactile firmness, so just say 99 every time my hand touches.
99, 99, 99, 99, 99, 99.
Good. And now I'm going to test for chest expansion, so take a deep breath. Okay, chest expansion is symmetrical. And now I'm going to percuss. Okay. Okay, and now I'm going to do your diaphragmatic excursion, so you can take a deep breath and let all your air out.
Mm-hmm.
Okay. Okay, so now I'm going to mark it.
You can simulate it too.
Okay. And then I'm going to take a deep breath in and hold it. Okay, so I would say the diaphragmatic excursion is about 7 to 8 centimeters. And now I'm going to take a listen to your lung sounds. Take a deep breath in. And again. And again. And again. And again. And again. Okay, and again. And again. Okay, now
You
we'll
can
listen to
pretend.
the back.
In the back. Does it get you dizzy?
No.
Okay.
I just started yawning.
Somebody yesterday almost fainted doing that. Go ahead.
Okay, lung sounds are clear, all lobes. Now I'm going to take a look at your heart. So there are no visible pulsations or heaves. Listen to points of your valves. And then I'm going to palpate the apical pulse. So aortic, pulmonic, herbs, tricuspid, and mitral. Okay, I'm going to listen with the bell. Aortic, pulmonic, herbs, tricuspid, and mitral. My nose is very runny. So S1 and S2 were auscultated. S1 is the AV valves closing, and S2 is the semilunar valves closing. There was no presence of a heart murmur, but if there were, I would turn her to her left lateral side, and I would also turn her to her left lateral side if she was pregnant or obese. Which she's not.
Good thing I made all those things.
Now I'm going to palpate the apical pulse. Okay, apical pulse is strong, regular, and rhythmic. Now I'm going to lay you down and take a look at your abdomen. Okay. So the abdomen skin is intact. There are no lesions or masses. There's no visible pulsation or peristalsis. The abdomen is flat. So now I'm just going to take a listen to your vowel sounds. Okay, vowel sounds are normal active in all 4 quadrants, and now I'm going to listen for bruits. Aortic, renal, iliac, and femoral. Okay, there's no presence of bruits in any of the abdominal areas. Now I'm going to percuss all 4 quadrants. And it'll be tympanic over the bowel and dull over organs. So it was dull over here where the spleen is, which is up here. And then I'm going to percuss for the liver. Okay, so the liver is about 6 centimeters, which is with the normal range, which is 6 centimeters to 12 centimeters. And now I'm just going to do some light palpation. Any tenderness or pain? Okay. Okay, now I'm going to do some deep palpation. Now I'm going to just palpate for your liver, right reaching under your rib. Okay, and I'm going to palpate for your kidneys. And also your aortic, your abdominal aorta, which is between 2.5 to 4 centimeters wide. Okay, and that's all for the abdomen, so you can sit up. And while I have you sat up, I'm going to do your CVA tenderness, so let me know if this hurts.
No. No.
Okay, very good. Okay, now we're going to do your upper extremities. As I said before, skin is intact with no lesions or masses. There's no edema. They are measured the same way. They're symmetrical in size. Okay, and I'm just going to put my hands here. And can you push your shoulders up against my resistance? Good. And turn. And turn. Good. And now I'm going to do your neck cervical range of motion. So can you touch your chin to your chest, please? Okay, and can you look up all the way to the ceiling? Good. And bring your ear to your shoulder. And the other side. And can you look side to side? Okay, good. Cervical range of motion is fully intact. Now I'm going to palpate your shoulders. Is there any tenderness?
Nope.
Okay, and how about the elbows?
Nope.
Okay, and the wrists?
Nope.
And the fingers?
Nope.
Okay, so there's no tenderness or crepitus in the shoulders, elbows, or wrists or fingers, and the elbow lymph node was not palpable. Now I'm just going to check your pulses. Pulses in the extremity, on the upper extremities are 2 clefts throughout. Now I'm going to check your range of motion in your shoulders, so can you lift your arms up and back as far as you can, and out to the side, and back in, and can you touch your head, and touch your back. Good. Shoulders have full range of motion, and your elbows, can you bring them in and out, and can you turn them out, and in, good, and can you bring them up against my resistance? Okay, and same for your shoulders. Okay, now can you move your wrist up and down, inside, good, and against my resistance, good, and can you bring your fingers out, and in, make a fist, good, and can you spread them against my resistance, good, okay, now I'm going to do your hot and cold. Okay, so this is warm, this is cold.
Okay.
You ready?
Warm. Warm. Cold. Warm. Cold. Warm. Cold. Warm.
Okay, I'm also going to do your legs.
Cold. Warm. Cold. Warm. Cold. Warm. Cold. Warm.
Good. Okay. And now I'm going to do the sharp to dull. Okay, so this is sharp,
Okay.
this is dull.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Good. Okay,
Yeah,
and
rhythm.
now I'm going to test for your vibrations. So just tell me where you can feel the vibration.
Okay.
Keep your eyes closed.
My wrist. My thumb. My pinky.
push against my resistance? Okay, and this one. And can you point your feet to the floor and lift them up? Okay, and turn them in and out. Okay, and can you push them against my resistance? Good, and down. Good. Okay, now I'm going to have you stand up. Okay, and can you lift your leg out and back? Okay, and can you turn it in and out? Okay, and can you lift this one and back and turn in and out? Good, and can you push against my resistance? Good, full range of motion is intact for the hips and the ankles, and can you bend your knee? Okay, and stretch it. Good, and bend and stretch. Okay, good, full range of motion for the knees. Now I'm going to have you walk to the wall and come back on your heels. Okay, and then walk to the wall again on your toes. And then heel to toe on the way back. Okay, good. Gait is normal and steady. Okay, I'm going to have you close your eyes. There's a negative Romberg test.